Now, the second week of Kenya's COVID vaccine rollout is picking up pace following a slow start since the exercise officially kicked off on March 5th. In Nairobi, plans are underway to scale up the deployment by opening up more vaccination sites as Kenya's total COVID-19 infection hit almost 114,000. Our Health and Science editor Dr. Mercy Korir was at Mbagathi Hospital to get her jab and now reports.
Kenya is not out of the woods yet, and the status of the coronavirus pandemic remains a concern. The latest figures show a 16.2% positivity rate following 731 new infections across the country over the last 24 hours. Almost 2 out of every 5 people admitted in hospital are in the ICU. The total number of those critically sick being 109. 5 more people died, bringing Kenya's total deaths to 1,918. The hope of many is that the vaccination exercise that kicked off in various health facilities will check the COVID-19 pandemic in the country. One by one, the frontline workers patiently queued for their turn to get the Oxford AstraZeneca jab on offer for all frontline healthcare workers in the country. The vaccine, said to be 63% effective, has been shown to reduce the chances of severe disease leading to hospitalization and death. Health workers from all walks of life, including those living with disability like hearing impairment, were here for their shot of hope. Not even challenges in communication could stop them from getting the vaccine.
As of end of last week, we had vaccinated 563 people. Today, so far, we have done 187. It's just 130. That is about 750 so far.
One only need their national identity card, their job ID card, and some more personal details, including a next of kin during the registration exercise. Those that have already gotten their jab report a smooth exercise and few, if any, side effects from the vaccine.
Just slightly painful, scale of 1 to 10, I'd give it a 1 out of 10. The nurse who administered it did a good job.
It was scary from the beginning, but only after 24 hours with experience of fever, general malaise, I was okay.
So I'm giving you the COVID vaccine.
And when it was my turn, after registration, a brief talk by the nurse, and I was ready for the job. A bit of pain in the left arm, and that was about it. In 8 weeks, I'll be due for the second dose. The Ministry of Health has identified 622 sites within the country as vaccination posts. Nairobi Metropolitan Services, NMS, plans to increase its centres from the current 3 public facilities of Mbagathi, Mama Lucy and Pumwani hospitals to include private hospitals so that many more people in the priority groups can access the jab.
They are just satellites because they have to be satellites of Mbagathi, which is the main center.
If all goes according to plan, the rate in which the vaccination exercise is being rolled out will be accelerated, and many more frontline healthcare workers will be vaccinated, doubling the numbers seen in the previous week. Dr. Mercy Korir, KTN News, in Nairobi.
Now, let's talk about the high cost of living, and the recent hike in fuel cost is set to see Kenyans pay more